My name is David Armstrong, and I'm the Director of the Health Workforce Technical Assistance Center. And today's event is entitled The Changing Face of Nursing, Understanding Trends in Nursing Turnover. Today, we're joined by Kyla Woodward, an acting assistant professor in the Department of Family Medicine at the University of Washington School of Medicine, and Esita Patel, an advanced practice data scientist at the Center for Advanced Practice at Atrium Health. Welcome, both of you. Kyla, would you like to get us started?
Thank you, David. Thanks everyone for being here. I'm going to talk to you today about ensuring a representative nursing workforce, and my collaborators on this study are Sue Skillman and Bianca Frogner. Just want to briefly acknowledge the land and peoples on the land I sit in and work in, and exploited workers, and the funding that we receive, although the contents do not necessarily represent the views of the HRSA, the HHS, or the government. So in this RN workforce project, our aims were really to look at the RN workforce before and after the pandemic. So looking at social demographics and work characteristics of nurses, and looking to see if there were any different outcomes for nurses in different social demographic groups. For this, we use the National Sample Survey of RN. So for those of you who aren't familiar, this is a survey run by the Health Resources and Services Administration Bureau of Health Workforce. It's been going since 1977, and the current sort of schedule is every 4 years. We're hopeful that this will continue. You can see for the most recent years, there are gaps sometimes related to funding and policy and those things. So the NSSRN gets responses from about 50,000 actively licensed RNs across the United States. And they make the data available in two ways. One is the public use files that you can download, and that's what I've used for the analysis today. And the other I wanted to point out is a nursing workforce dashboard, which they host on their website. You can just look at the NSSRN dashboard. And it's a great way to get a glimpse of the workforce in your particular state or region. Social demographics, they have work environment, earnings, they have just some other snapshots of information if you don't want to do a more extensive analysis. The NSSRN asks a battery of questions about social demographics, educational preparation, both nursing and non-nursing, current and past employment. They ask about job characteristics and job logistics. So for example, what are you working part-time or full-time? How many weeks a year? Job intentions, and then work experiences within those jobs. So those are things like how much of your time do you spend in these kinds of tasks versus these kinds of tasks? What kind of patient populations do you work with? Do you have the training you need to deal with these populations and those kinds of things? They update the variables every cycle to meet changing needs. So for example, this 2022 survey included questions specific to the COVID timeframe. Some limitations of this data set. They provide public use crosswalks of the data, but there's not consistent data harmonization. So when you're comparing several years, as we are here, there can be changes in the variable options and the coding structures that just require some attention to detail. And we'll talk about some of these other limitations as we go through the data. The advantages of using the NSSRN is that it really has far more explanatory detail in terms of job outcomes, and does a better job describing the job logistics and work characteristics if you want to study RNs or advanced practice nurses. So for this project, it's obviously a secondary analysis. We used the 2018 and 2022 NSSRN respondents, looking at those who were working in a nursing job in December of the year prior to the survey. So they're surveying in 2018 and they say, were you working in a nursing job on December 31st of 2017? And then the follow-up question to that is, did you leave that nursing job? So that's where our sample and our outcomes are coming from. And we used RNs who were not advanced practice RNs. We did some descriptive analyses of the different characteristics of nurses across the 2 years. They provide sample weights, so the estimates are drawn from those. And we did some chi-square comparisons of those differences, as well as regression analysis. So here's a first glimpse of the demographics between the 2 years. And so in general, throughout my slides, that asterisk indicates some significance on a chi-square analysis comparing the 2 years. So you can see that the estimated number of RNs is slightly higher in 2022. Mean age is also a little higher. And we have a trend towards a greater proportion of male nurses, which is consistent across other nursing workforce surveys. When we look at race, just to note that we have grouped this category together that represents American Indian, Alaska Native, Native Hawaiian, and Pacific Islander as more representative of Indigenous peoples. And then the other categories are as provided in the data. You can see we have some shifts in that racial distribution of nurses from 2018 to 2022, moving towards greater representation, a greater diversity in the workforce. When we look at ethnicity, this is one of the areas where the 2018 survey weighting tended to overrepresent Hispanic RNs. So it looks like there was a 1 percentage point decrease between the 2 years, but that we're not convinced that that is true. In education, we have a trend towards bachelor's or higher as the initial RN preparation, and towards more nurses who were educated in foreign countries. I did want to just show a quick glance at a more detailed race and ethnicity together. So this is combining Hispanic ethnicity. So the Hispanic a row here represents an Hispanic nurse of any race, and then the other columns are that race only. So just pointing out that in some of these, there is quite a small N. So as we've combined and making conclusions, some of these are not as impactful due to the low Ns. The other thing I'll note is that the percentage of Black RNs in 2022 is 12%, which is much higher than some estimates from some other workforce surveys, but more aligned with data from a current population survey or American Community Survey. So RN work characteristics. So here we can see, I think, some interesting findings in terms of FTE. So a much higher percentage of nurses working full-time in 2022 compared to 2018. Fewer nurses having 2 or more jobs. And then this household earner we constructed, this is not a perfect variable because we don't get the hard and fast numbers for everything, but a tendency towards RNs providing more of the financial contribution to a household in 2022. In work settings, again here, I apologize to those of you who work in one of these categories like public health that feels like it really doesn't fit with ambulatory and community health. It's an imperfect grouping, but we tried to represent some of the different settings across the board. You can see there's some increased representation in like consultant and indirect care or remote and telehealth work across the board, and a slight decrease in the percentage of nurses working in long-term care, behavioral, or home health. Looking in these different settings at the racial distribution of RNs, this came out of Dr. Frogner's, and I had some previous work looking at the healthcare workforce writ large to see if the pandemic created some more opportunity for folks to move into jobs that had better pay and benefits or more preferable schedules and that kind of thing. So we're looking at this in the nursing population here to say, do we have more diversity in these different settings, and what might that represent? So here you can see Black nurses are this purple bar, and they have the largest gains in diversity in telehealth, inpatient care, and ambulatory settings. And then Asian nurses also had a large gain in the inpatient, ambulatory, and long-term care settings. Across the board, we see some increased representation in all the settings. So everybody wants to know about turnover. So we're looking at changes in nursing job outcomes between the 2 year. And so we broke this into 4 categories. One is nurses who stayed in that primary job. And then of the nurses who left a primary job, did they retire? Did they leave a job, but they stayed in nursing, meaning they got a different job or intend to get a different job? Or did they leave the profession altogether? So these numbers are quite interesting and pertinent today. I think this is probably the most significant number of them all, that we had a 14.6 percentage point increase in nurses who are leaving their primary job between the 2 years. So my next question is, are we losing those nurses altogether? And it looks like there's just a very small 0.5 percentage point increase in RNs who are actually leaving the profession when they leave a job. So this tells us that folks are switching jobs, but this data does not suggest that we are losing nurses in droves when they leave a job. Among different groups of RNs, we can see some different trends in where they're staying or leaving and where they go. So the numbers across the top in bold are the average, and we can kind of compare the different groups to the average for that category. So you can see, for example, that Asian nurses are more likely to stay in their job than other groups, and that white nurses are the ones retiring most common, which I think is quite interesting. They're almost more than twice as likely as any of the other groups to be retiring. Other trends you can see are that the Black and multiracial nurses are some of the higher percentages leaving jobs and some of the lower percentages to leave nursing. So that may indicate that there's something happening within jobs that's forcing nurses to look for a better position, but not leave the profession altogether. I also wanted to take a peek at leavers by setting to say, are there settings where we're really losing the most nurses from, or settings that are doing a better job at holding on to nurses? And so you can see here that the remote telehealth and consultant or indirect care settings, which are not hands-on patient care, are doing the best job at keeping people in those jobs, but that people are more likely to leave a job from settings like inpatient medical hospital and the long-term care behavioral home health. So just interesting to think about, are there ways jobs are set up where people are working in a different setting and see opportunities to stay in nursing, or see opportunities outside of nursing that are more appealing? So just thinking about some of the different structures and features of jobs. Reasons for leaving. So here's where the NSSRN really provides us a nice set of robust data. So this question is a select all that apply question. So all of these white boxes represent one or more items that nurses could check on a list of why they left their job. I constructed these categories to put together things that are related. For example, safety, feeling their personal safety is impacted at work, or they have this set of like life circumstances happening that means they have to leave their job. So again, groupings are imperfect, but trying to just get a handle on what's the kind of category that's driving people to make job decisions. And in this analysis, we pulled pay to be its own thing, separate from the career category, because it just had a different profile than most of the other elements in there. So here we can see reasons for changing jobs. So this is an RN left their primary job and they are still working in nursing or looking for work in nursing right now. I pulled out the top 5 categories and they're kind of in ranked order here, seeing if there's any differences between 2018 and 2022. So you can see work environment, while there was no significant change between years, it's just grossly and unacceptably high that people are having such issues in their work environment. Well-being and safety are 2 things that rose significantly between those 2 years as concerns driving people out of jobs. Pay and career, there was also significant differences, although not as great as in those other categories. And then just a quick look at the same set of data for nurses who left the profession altogether and do not intend to work in nursing again. So you can see again, well-being and safety were the significant and largely increased elements. Work environments continues to be high, but not a significant change between the years. And just to note that RNs who left for retirement, about 30% of them also cited well-being and work environment as their reasons for retiring. This graph just shows you the percentage point change in nurses reporting this reason between years. So the positive for number means that many more percent reported this issue for leaving. So the dark bands are those who left nurses, and the lighter bands are those who changed jobs. So for example, there was a bigger increase in nurses worried about safety who were changing jobs compared to those who left nursing. And you can see the same three reasons are kind of at the top, and then career and life really had very small increases or decreases as the motivation for a job change. I also wanted to take a look at the reasons among different racial groups of nurses to see if there were any interesting trends. And so here I've highlighted in red the top reason for that group of nurses, and in green the least cited reason for that group. And I think what's interesting and important here is that there's different profiles among different groups of nurses in terms of, what are the biggest factors for them as a whole versus the least important factors. So just understanding that it's not everyone has the same experiences driving their decisions to leave. And finally, this is a regression analysis. So I'm showing of the 2022 data. Unfortunately, they changed their methods in calculating variance between the 2 years. And so try as we might, we could not find an appropriate or meaningful way to put them in a regression together and get a meaningful outcome. So these are the findings for the 2022 data. And I've just put that superscript 18 behind the variables that were also significant in the same direction in the 2018 data. So you can see some of these factors that increase the odds of leaving, like having an associate's degree or lower, increase the odds in both years. While working part-time or being of Hispanic ethnicity just increased your odds in 2022. Agency employment is, I would call it sort of a known factor. When you're working for a temporary staffing agency or a travel agency, you're more likely to change that job. And then the factors that decrease the odds of leaving, being over 34 years old in both years. So the trends towards our younger nurses being more likely to leave have continued. Being Asian or foreign educated in 2022 gave you lower odds of leaving your job, as does working in ambulatory care in both years or in the consultant or indirect care setting. So some different profiles across the years of demographics, some different reasons for leaving, likely some of those in 2022 related to COVID. But I think among these common themes, we can see that different groups of nurses are having different experiences related to their sociodemographics or related to their work setting. One of the really important takeaways for me from this is being very explicit about the language we use when we're talking about nursing jobs, like vacancies versus a shortage, because we aren't seeing this massive exodus of nurses completely away from the profession. We may be seeing a lot of job vacancies because people are saying, I'm not going to stay in this job where the work environment is bad, where I don't feel well, I don't feel safe. So those vacancies are a different phenomenon to address than a workforce shortage itself. I think we have known for a while that well-being and safety are increasingly important in retention. And they're essential if we're going to protect against nurses leaving the profession altogether. We know that workplace experiences in general continue to be really important in driving nursing job decisions. So the implications are not new to me. We need to identify and implement some policies and practices that can improve well-being and safety in a positive work environment. But we need to do these at a systems level. This is a nationwide problem we're experiencing, and one hospital, one organization, one unit changing things is not going to meet the needs across the nation. We really need to look at some of our state policies, some reimbursement policies or regulations that drive workplace experiences and the way that work has to be done or has to be documented. And I think even looking at things like our approaches to patient satisfaction and what elements we're focusing on for nurses and other clinicians in the workplace are important too. While we have made improvements in the representation, the racial and ethnic representation of nurses, we need to continue that work and look at matching the representation with the population that those nurses serve. So thank you very much for your time. I'll look forward to your questions at the end of the panel.
Thank you, Kyla. Esita?
I am so excited to talk to you all about the nurse practitioner side of this. I was telling Kyla and Aaron today that I was almost more excited to hear the nursing piece to see how it kind of compares, contrasts to this piece. So this is a very similar study using the same survey, but focused on nurse practitioners, looking in 2018 versus 2022. Oops. This project is done in collaboration with the Carolina Health Workforce Research Center, and Erin Freyer has been my partner in crime in this work, and I'm so grateful for her mentorship and collaboration on this project. And I'd also be remiss not to mention my boss, Dr. Brittany Broyhill, who worked on a previous iteration of this project using just the 2018 data. She is our Chief Advanced Practice Executive for Atrium Health, oversees the operations of over 3,000 APPs, and has brought such a deep kind of organizational leadership lens into what these researchy findings truly mean for people who are really worried about keeping their workforce or getting the right people in with an advanced practice lens. A little bit of background. We all know that turnover is really expensive. Sullivan Cotter 5 years ago now estimated the direct cost of advanced practice turnover to be around $100,000. And it's probably a lot more because that doesn't include indirect costs, and it's 5 years ago. We know that a lot of work in this space around why people leave or stay, a lot of it focuses on intent to leave, other than work that comes out of the NSSRN survey. And that is because once a nurse or a nurse practitioner leaves, it's hard to get data on them about why they left, why they truly turned over. So instead, a lot of work is done on the current workforce and their intentions to leave or what would possibly make them leave. So the NSSRN is a really cool source to allow us to look at people who actually left and why, or people who stayed and why at a national level. I was really interested in this question of if people stayed and left during a stable period, right, when the world's not on fire, versus a pandemic when healthcare felt like it was on fire, if that was different. And I thought this was really interesting and important to know, because better understanding this can help us tailor recruitment retention strategies. And also, if the world is on fire again, understand, hey, turnover might double like 3 times as much as it has been in the last few years. How can we put strategies in place to address this? We are anticipating this because we know the past data shows us this might happen. And then these are the factors that are going to be really, really important for us to hone in on to keep the people we have, and possibly also think about how to get people in. So the aims of this study are to compare turnover rates, intention to leave rates, reasons for leaving and staying during a pre-pandemic period, 17 to 18, versus a mid-pandemic period, that's 21 to 22, for nurse practitioners in hospital and outpatient primary care settings, which are the 2 largest settings that nurse practitioners work in. We used 2018 and 2022 NSSRN data, and I guess I don't have to get into the weeds of this survey because Kyla did a wonderful job giving an overview of what it is. It's on RNs, but as we know, a lot of RNs are NPs as well. So it is a great source for looking at APRNs, advanced practice registered nurses, and I specifically was looking at nurse practitioners. And I included all nurse practitioners that were actively working in a hospital or an outpatient primary care setting in 2017 or 2021. And I know that Kyla said this already, but the way the survey works is it asks, hey, where were you working December 31st, 2017 or 21? Tell us all about it. Tell us all about your role. Okay, now are you still there a year later when you get the survey? And if you're not there, tell us why you left. And if you are there, tell us why you stayed. And so that's how we're able to get all of these data that we get to dive into today. A response to the question, yes, have you left this nursing position that you held on that date, is used to signal turnover at the time they get the survey the following year. We compared turnover, intention to leave, and reasons for leaving or staying, which are pre-populated reasons, those same buckets that Kyla showed between 2018 and 2022 data. And we also conducted a multivariate logistic regression to try to understand odds of leaving by various characteristics. To account for complex sampling methods, we applied survey weights in all of the analyses we did as specified by the NSSRN variance guide. So those are all available online. The 18 version uses a jackknife replication method, and the 22 uses a successive differences replication method, which just means that they use different strategies to estimate those variances for the population estimates. And they also have a different number of replicate weights between years, which just means we couldn't combine the 2 years of data and do some sort of repeated cross-section approach in a single analysis. Instead, we had to analyze the 18 data and the 2022 data separately, which it sounds like, Kyla, you might have ran into a similar struggle there. We also had to construct our primary care variable to align. So the 18 data and the 2022 data defined primary care a little bit differently. We were able to use the same definition for hospital in both years, but for outpatient primary care in 2018, we used a combination of that setting variable and specialty variable. In 2018, for outpatient primary care, the setting was called clinic ambulatory, and we required their specialty to be either ambulatory care, including primary care, except surgical care, or there was another option of just primary care. And then in 2022, the setting was called outpatient, and we required the specialty to be ambulatory care, primary care, which was only a single option in that 2022 survey. So there was a little bit of nuance of how that primary care variable was constructed, but the numbers all seem to make sense with how the workforce has shifted over time. This is our first cut of data. So this is just demographics data looking at the workforce in 2018 versus 2022 of hospital and primary care NPs. And the first thing that is really striking and similar to the RN study is holy moly, did turnover increase between the 2 years, almost doubled. So in 2018, it's about 10.7%. And in 2022, it's about 19%. So we see this huge uptick in turnover. What I thought was really interesting, on the other hand, is this intention to leave. So the plans to leave within a year, 1 to 3 years, over 3 years, you're planning to leave, you're not sure when, those all remained relatively stable. So intention to leave was relatively stable during this time period, but turnover saw a huge uptick. And this whole study is to try to understand maybe the why. We see a big increase in sex. We see increase in males. We see a huge increase in non-white race, which likely has to do with a lot of efforts around trying to get the workforce more diverse, looking like populations they serve. That's a continuing trend or emphasis. And then we see NPs making more in 2022 than they did in 2018, which makes sense as salaries continue to increase to keep up with inflation and the times. This is a continuation of that demographic table. So we see that there are less new NPs in 22 than in 2018. this, we saw that the APPs who put organizational emphasis on team-based care and evidence-based care, those remained relatively stable. But I thought what was really interesting was this perception of an APP or a nurse practitioner's ability to practice to the fullest extent of their training or education. There was an increase in this by about 7 percentage points. There were more NPs in 2022 that felt that they could practice to their fullest extent of their training or education. And this is particularly asking about their role. In 2022, there's actually a separate question that's asking about your state's, you're practicing according to your state's laws, but this is asking more about their role. So there has been a lot of emphasis around better utilization of the advanced practice workforce to do the jobs that they were trained to do. No one wants to be used as a scribe when you've worked so hard to become a nurse practitioner. So perhaps this is something we're seeing in the data, and maybe in 2026 data or whenever we see it again, maybe it'll continue to rise, which would be interesting. We also see more NPs work part-time in 22 than in 2018. Could be due to pandemic. It could also be due to a newer trend with generations, newer generations wanting more of a work-life balance or choosing to work part-time as time goes on. So this is the first graph looking at reasons for leaving by 2018 versus 2022. 2022 is in the light blue and 2018 is in the dark blue. And it's in order of the most important reasons in 2022. It's a lot of data, and I know we have a limited amount of time, but just to walk you through some things that I thought were really interesting when I was staring at this is the top 5 reasons for leaving are the same top 5 reasons in 18 and in 2022, but they're more pronounced or more frequently reported in 2022 than they are in 2018. And that tells me a few things. One, it tells me that the things that are most important to people kind of remain the most important to people, regardless of if the world's on fire or not. And that's really exciting. But it also tells me that perhaps there's an increased awareness or awareness bias. The literature has skyrocketed around provider wellness, things like stress, burnout, things that people are understanding, providers are understanding. Provider wellness is a big topic. So maybe providers are more likely to say, hey, yes, I'm burnt out, and be able to report that on these surveys in 2022 versus 2018. Likely it's a combination of both, right? I'm sure the world was a lot more stressful during the pandemic than not, but there might also be this element of increased awareness of these items. One thing I thought was really interesting was this relocation to geographic area variable. That NPs were more mobile in 2018 versus 2022. So from a workforce planning perspective, that tells me that NPs during a pandemic, you're more likely to get more bang for your buck by trying to rely on the NPs you have in your geographic area versus focusing on external recruitment techniques to try getting people in during a pandemic, versus in a stable period, maybe people are more likely to relocate. Another big thing that I thought was interesting was there wasn't a huge difference in retirement. We thought that perhaps COVID would drive people close to retirement age to just go ahead and do it, but it didn't come up as a significant difference between 18 and 2022 data as a reason for leaving. And then this last one, laid off and downsizing of staff. NPs were more likely to be laid off in 2018 versus 2022, which is different than what we see in a lot of other occupations during this time period where we talk about having, mass freezes or jobs shutting down, but healthcare seemed to be the opposite, of course, because people were needed to do the jobs because there was a pandemic going on. So wasn't as big of a problem for this workforce. This graph is just a flip side, right? So now we're looking at reasons for staying. Of all the people that stayed in their roles, this asks, why did you stay? And it's really interesting that the number one reason is liking the job. I mean, yeah, that makes sense. This wasn't asked in 2018. It was a new question or a new addition in 2022. But I think all of the other ones get at maybe what contributes to someone liking their job. But I just thought that was funny. Like, yeah, of course you want to stay if you like what you do. Makes sense. The most important reasons for staying, aside from liking the job, were balanced schedule and hours and salary and benefits, which also were top reasons for leaving, which kind of points to maybe these top strategies that show up in both might be like really important for people to consider when they're considering how to better address turnover in their organizations. Another one that I thought was really interesting here was this availability of resources to do job well. It was a lot higher in 18 than it was in 2022 as a reason for staying. And I'm not sure, right? I don't know exactly why people chose it, but I'm curious if having availability of things like PPE or masks or personnel during the pandemic led to some of those choices. And then finally, all the way down here, the use of telehealth skyrocketed during COVID. And that was a reason people picked for staying in their job, which I think was really interesting. And we continue to see an increase in virtual care and telehealth. And it's something that contributes to people staying. So it's a really interesting trend that came out of the pandemic. All right, so this is the logistic regression looking at drivers of leaving employment setting. And we had to do two separate models again for 18 and 2022, and then just kind of looked at the data to see were things important in 18 that weren't important in 2022 or vice versa. Age wasn't important in 2018, but it did show up in 2022, where people in those middle years, that 40 to 64 range, were less likely to leave than people who were a lot older, a lot younger. That was interesting again. We saw that sex was another important variable both years, where females were more likely to leave. This is interesting in this workforce that is primarily female, thinking about, what that means, what the repercussions are, what are some protective things we can put in place for a largely female workforce. We see that those of non-white races are more likely to leave. In both years, we see people who are making more or less likely to leave. So a greater household income is associated with decreased turnover in both years. We also see that experience is linked to turnover, where the more experienced a nurse practitioner is, the less likely they are to leave compared to people with less than 3 years of experience. This is a continuation of that same model. It just was too much to put on one slide. But continuing on, we see organizational emphasis on team-based care was a driver of turnover in both years. But interestingly enough, this organizational emphasis on evidence-based care, which was asked in both years, it didn't come up as significant in 18, but it did in 2022 in the middle of the pandemic. And I'm curious if that's because we knew that recommendations were rapidly changing during this time, what clinicians were supposed to do and what's considered safe and what kind of masks you're supposed to wear or not wear, or PPE guidelines were rapidly changing during this time. And if organizations had the resources to be agile and keep up with this and put this into rapidly into place, could that have contributed to some of these perceptions and wanting to leave or not leave? Again, all speculation, hard to know, but it's just something that I think would be interesting to follow up on. Ability to practice to fullest extent of scope and training was important in both years. It was the most important driver of leaving in 2018. And it became less important, or I guess the odds ratio was smaller in 2022, but still a driver of leaving if you felt like you could not practice to your full extent of your training or education. And again, this question was around perception, not the state law. You were more likely to leave. And then we see that setting, hospital versus primary care in 18 wasn't a driver, but in 2022, primary care APPs were more likely to leave than hospital APPs. And then we see that people who worked over 40 hours a week in 2022 were more likely to leave. But that's a lot of data. And so I love a good so what slide, right? We saw that NP turnover nearly doubled between this time frame, between a stable period and a world on fire period. We know that burnout and stressful work environments are top reasons for leaving, and they were reported at much higher rates in 2022 than 2018. We didn't see turnover driven by setting, hospital versus primary care in 18, but it did seem important in 2022, and that warrants further exploring what might have been happening differently in primary care versus hospital in this year. And Erin and I have a kind of offshoot study doing just that at Academy Health. Stay tuned. Also, the relative importance I put, or the ranking of reasons why people stay or leave, is similar between years. So this was really exciting to me, because if we know that the things that are really, really important to people are kind of the same, regardless of year or world on fire, and I actually have done similar studies looking at it by rurality or setting, it always seems like these top bucket of reasons are what is important for people when they make decisions to stay or leave. We know that those are the ones that people who care about this stuff can address. So it doesn't have to rapidly shift based on kind of what state you're in. It's that these are kind of high yield things that organizations or policies can really try to tackle. And a lot of these are modifiable factors, right? Better pay and benefits. You can't make everyone millionaires, but thinking about what competitive pay is, or having your workforce understand why they're being paid what they are. A balanced schedule, good management or leadership, especially in the advanced practice space. Is there management or leadership that's supported by APPs, or are they reporting directly to APPs versus not? Ability to practice to one's full scope. Again, no one wants to work as a scribe when you've worked so hard to become a nurse or a nurse practitioner or whatever. Attention to identifying and addressing burnout and stressful work environment. Those will always, always, always be important. So with that, I thank you. I'm really excited for the discussion and to hear everyone's thoughts.
All right. Thank you, Esita, and thank you, Kyla. Wonderful presentations. Kyla, you went first, so we can start with you. Now, you focused on RNs who actually left a job. But what about all the RNs who stayed or said they intend to leave or want to leave a job? I mean, how do those reasons line up with the other ones?
Yeah, that's a great question. It's been sort of one of my little pet peeves when we talk about a job intention and an actual job decision as the same thing, because we know that they're not, right? Like, I have many days where, as a nurse, where I wanted to leave my job, but I didn't leave my job. So just understanding that the intentions to leave are rooted in some of the same causes as actual job decisions. But if we look in the organizational behavior literature, they say actually there's some important differences in maybe how you're working and how you're operating in the workplace if you want to leave your job but you can't, versus you don't want to leave your job. And so I've tried to be very very clear about, when I'm talking about this specific outcome of leaving a job, of letting that be by itself. And I think Esita looked at some of those, like reasons for retention. Those are also really important things. I wouldn't say that they're not, but I think it's also important to say, what are the reasons actually driving departures? Like, when does it get bad enough, or what makes you actually drop the hammer at that moment?
Yeah, that's a good point. Thank you, Kyla. Okay, we do have a question. It's a little bit long, but here we go. It is interesting to see that Asian nurses stay. Was there any data on the Asian nurses and being foreign educated and on work visas? Being on a work visa may make them less likely to leave in fear for losing their visas. Did they break up Asians into subpopulations? Far away.
Yeah. That's a great question. And so there's actually, in previous iterations of the NSSRN, I've read some studies where Asian nurses do tend to be more likely to stay in their jobs. I don't believe there's a variable in the NSSRN for if they're on a work visa. They did offer detailed breakdowns in the survey about what, the different, are you a Filipino nurse? Are you Vietnamese? But they didn't, in the public use files, that's not available. And I can just imagine that because the number of N's is so small, they've got to protect those nurses. But I think that's a really important question to look at. I know that that's been borne out, at least in the NSSRN, but I don't know about that in other studies. So it's a question mark. It's the next study.
Well, there you go. Esita, do you have anything to add, or I can move on to our next question?
I wish I had something to add. Which something I really appreciated about Kyla's work is how you broke down race and looked at kind of different drivers based on that. I just dichotomized the variable because of some of the buckets being too small to meaningfully compare for within nurse practitioners. But I didn't specifically look at Asian nurse practitioners, so I'm not quite sure. But it's a very interesting question.
Okay. Well, since you're already talking, I'm going to put you on the spot then. Sorry about that. Were you surprised by any of Kyla's findings in relationship, for RNs versus for NPs? Did you see any similarities? What differences, did you see?
Yeah, certainly some similarities, a few differences as well that I was kind of intrigued by. The similarities made me say, phew, okay, the workforce is doing similar things in both areas. The giant uptick in turnover, I didn't realize was even more pronounced for nurses than it was for nurse practitioners. More than 1 in 4 nurses left that job. That was really intense to see. The increase in males and diversity was also similar in terms of workforce demographics. And then one thing that I thought what I was a little nervous about when I saw it in my data was there wasn't this huge uptick in the number or like proportion of nurse practitioners in primary care versus hospital. Because of all of this effort and emphasis we've heard on care shifting to primary care, I thought I'd see a bigger shift, but actually it looked very similar in your breakdown too. And I wonder if maybe the world isn't shifting as swiftly to everything being outpatient primary care as we originally kind of said it would years ago. One thing that I thought was really interesting and different was I think you said that ambulatory care RNs, that was associated with a decreased odds of leaving. And in 2022, for me, it was primary care, which is similar. But for me, primary care was increased odds of leaving compared to the nurses in hospitals. So I was curious what could be driving that. And then I really admired how you grouped your reasons into buckets. That might be something I'll have to think about implementing when we write up our paper, because it was a good way to put so much data into different groupings.
Right, thank you. And we do have another question from the audience, actually a couple of them. Did you notice any notable regional differences? Is that something you explore, or how can state level data inform targeted retention strategies, that is, in general? Did you explore regional differences in turnover?
I did not look at different regions. I think it would be interesting to look at it. There's a lot of ways to cut it, whether you look at a region or whether you look at rural and urban, how you kind of break those apart to better understand, that work experience within that section. State level data, I think, is great. When I've looked at just the numbers in the NSSRN, I've felt like there haven't been quite enough of an N in each state of like nurses who left to really well represent what might be going on in the entire state. So that's a difficulty. I wish there was this level of data with the same like sort of robust numbers we get from some of the smaller state surveys. I think that would really be informative. But at this point, I don't feel like there's enough to reach substantial conclusions, I guess.
Right, thank you. Okay.
And I would say for the nurse practitioner side, I have looked by rural, urban to see if there are big differences and reasons for staying or leaving. And it tells a pretty similar story to the one I told today, where some things are more important or less important, but the relative ranking of things that are important to people remain kind of the most important relative rankings of things that remain to people. I've also bucketed states based on full practice authority or not. So that's something kind of different for nurse practitioners, where in some states, nurse practitioners don't need a supervising physician to practice autonomously, or there is a pathway to do that. And in some states, there's a lot more physician supervision requirements. So I've done some analyses, actually some just yesterday and this morning, trying to see if there are differences that pop up there. And I actually haven't found anything super meaningful yet. So yeah, that's the best I can do to answer the regional differences for now.
We'll keep looking at SOP. I mean, that's always a large topic when it comes to NPs, especially, obviously. Uh, well, the NSSR, it asks a lot of questions about different employment characteristics. How did you decide on which characteristics to examine?
For me, it was a little bit about thinking about ones that are popping up as important in the literature, of course, and then also, which I don't know if this is the right answer or not, but making sure they're available in both cuts of data, because there were some that were in one versus not the other, ones that were kind of similar, but the wording was changed so much that I couldn't trust it. And so even though there are so many to choose from both, that kind of whittled it down, especially after aligning what pops up as most important in the literature.
Yeah, and in similar fashion, like wanting to choose things that we could see in both. And we also looked at, what are some factors that are common across settings? So, for example, if you're asking about, you know, different populations or different like sorts of tasks, those are all available in there, but those are going to be very different. For example, if you're a school nurse or if you're a nurse who's a consultant to, an insurance firm. So trying to pick some things that were perhaps um, more more unified across an RN job, I think was my approach.
All right, thank you. Thank you, both of you. Next question. Have you explored at all how pay and setting may be related with RNs and NP staying or moving to a new setting?
That is really interesting. So I guess not directly, but indirectly, I looked at differences in turnover by primary care and hospital, and we know that NPs in hospital jobs versus primary care jobs, the pay is often better in some of these like more subspecialized, highly acute hospital-based roles than the primary care roles. And we did see greater turnover in primary care, and we saw a greater proportion of primary care APPs saying that pay was a reason why they left their job.
Yeah, I would say on the RN side, it's a great question, and we just didn't do that level of, there's a lot of adjusting that has to happen to talk about, pay in one region for another with different costs of living and that kind of thing. So I think that would be a really interesting analysis that would require perhaps a little more, you know, diving into those different elements that, what does your $50,000 get you in one state versus another kind of questions. But I think that's a really interesting question.
And I have another interesting question too, or two as it happens. And I know we're kind of headed towards the top of the hour, but hopefully we can at least get through these final couple of questions. Big picture, given the limited resources, where would you recommend workforce leaders focus first on? Improving recruitment efforts or strengthening retention?
So maybe I'll say that this is one of the questions, because I know I said this message of what is most important to people remains the most important to people. But this is one that I might say might be different if the world is in a state of rapid turnover, resources are scarce, there is a pandemic going on, because we saw that the workforce seemed a lot less mobile during those kind of periods of time versus in 2018, where there was a lot more NPs leaving because they relocated somewhere else. So if your workforce is more willing to go somewhere else, then recruiting in seems like a good strategy. But if your workforce is kind of stuck where it is, then really focusing in on who you have might be your best bet. So maybe that's a way to use this information to target it. But that finding aside, my kind of perception of this is you should always focus on the people you have, because you already have them, and losing them is a really sad loss of human capital. It's time that you've invested in bringing this person in and onboarding them and invested in them. So I think efforts to keep the people you have is always where you'll get the most bang for your buck.
Thank you.
I would concur with that. I think if you create a place where people want to stay, then people are going to be drawn to that when they hear about it or experience it. That is that is meaningful to all the people who are there already and not just folks looking to come in.
Very good. So correct answer, retention then? Is that how? No, I guess it's probably a little bit more complicated than that. Well, we have one more final question here. I noticed that there is new interesting question about like whether or not a nurse is a traveler. There is an indicator in the NSSRN about traveling nurses. And during the pandemic, there was a surge of travelers. Did you see or plan to analyze any data on travel nurses?
I have not seen an analysis of that. I know within the Center for Health Workforce Studies at the University of Washington, where I am, they did do a study on travelers, and I apologize, I can't remember if that's been published yet or not. I think it's an interesting question. I don't remember the N. I don't remember how many there are, if it's really enough to get at some meaningful data, but I think that would be a great area to explore.
For I think travel nursing is probably a lot more prevalent of a phenomenon for nurses than it might be for advanced practice for nurse practitioners. I just took a peek. It's actually one of the reasons people can leave or choose for leaving their job, and it was the least frequently cited reason for leaving their job during the pandemic and in 2018. So I don't know if it's as prevalent of a phenomenon for nurse practitioners.
Yeah, and just a comment. Someone has recently submitted a paper on travel nurses. It's qualitative and not from the NSSRN. And I know there's some other work being done on it using the NSSRN as well, though. I believe there might be a study at GW, if I'm not mistaken.
Okay. Yeah, this qualitative was from the UW Choose. Thank you for answering that. I think I know who you are.
Oh, okay, that's what it is. And y'all confuse me because we don't say choose, but I am housed at the Center for Health Workforce in New York. So
same name, opposite sides of the country.
Well, we've got it all covered then, right? That's how it works. Well, I mean, this has been a wonderful presentation. Thank you very much for providing us with this excellent information. And there's 1 minute left. Is there like one take-home point you would like our audience to go away with today? I'll give you all the floor.
I think clearly this is an area that we need to work on, and across all levels. It's not limited to one location. It's a problem, but I think if we all come together and figure out some solutions, starting at that systems level, trickling down, that'll be the best thing that we can do to have a strong nursing workforce.
Thank you, Kyla.
I think my takeaway is so many of the things that I presented today were like, yeah, no duh, right? And we have so much data that shows what's really important to people in making these decisions. So then we really need to move this work forward into like translating it, whether that's I think so much at the organizational level because of the work I do within organizations. And of course I'm biased, but I think my organization's doing a great job at taking these findings and trying to make sure they're like living and breathing within the work we're doing with our advanced practice workforce, but then also thinking about, at greater scale, policies that can be used to make sure these things that are clearly important to people and no duh are actually being translated to actions.
Well, with that said, I will thank you once more for participating in our event, and thank you in the audience for attending. I hope everyone has a wonderful afternoon.